Welcome to Explain, a series of health education programs published by the Patient Education Institute, the leading provider of interactive health education. This video includes general medical information and does not replace the medical advice of your doctor or healthcare provider. If you have questions pertaining to your medical condition, ask your doctor or healthcare provider.
Dandruff. Introduction. Dandruff is common, and most people have it at least once during their lives. It's generally not serious, and it isn't contagious. A gentle cleansing shampoo can be used to treat mild cases of dandruff. If that doesn't work, a medicated shampoo may help. This program explains dandruff. It discusses the symptoms and causes of the condition, as well as treatment options. Dandruff. Dandruff can affect the scalp or any area on the body that grows hair. Cradle cap is a kind of dandruff that happens to newborns and babies. It can cause scales and crust on the top of the head. It's not dangerous. Normally it goes away before a baby's first birthday. Symptoms. Dandruff symptoms include an itchy, scaly top of the head and flakes of oily, dead skin in your hair. It can show up on your neck and shoulders. It may be white and dry. The skin on your scalp may look red or pink. Many people with dandruff don't have an oily, red or flaky scalp. Their only symptom may be white flakes that fall to their shoulders. More severe cases of dandruff may burn or itch. Because the fall and winter are dry, symptoms of dandruff may be worse then. The symptoms may get better in the summer.
Sponsored by the Patient Education Institute. www.patient-education.com. Over 5,000 videos and interactive tutorials.
Causes. Dandruff can be caused by several conditions. Dry skin is the most common cause of itchy, flaking dandruff. This can happen during winter when the air is cold and rooms are overheated. Dry skin flakes are normally smaller and not as oily as dandruff from other causes. You may also notice dandruff on other body parts with hair. Oily skin can also become irritated and red. This can lead to yellow scales or white flakes. This is called seborrheic dermatitis. Seborrheic dermatitis can affect your face or body. Affected areas may include your armpits and groin area, chest, ears, eyebrows, and nose. Sometimes dandruff happens from not washing your hair enough. This can lead to a buildup of oil and skin cells. Psoriasis is a skin disorder that causes a buildup of dead skin cells. They form thick, silvery scales. Psoriasis commonly happens on your knees, elbows, and trunk, but it can also affect your scalp. Eczema causes red, swollen, and itchy skin and can lead to dandruff on the scalp. Contact dermatitis happens to people who are allergic or sensitive to certain hair products. This can also cause dandruff. Shampooing too often or using too many styling products also may irritate your scalp, causing dandruff. Malassezia is a yeast-like fungus that feeds on oil. Most people have a normal amount of this yeast on their scalp. Sometimes the yeast can build up and cause an overgrowth of skin cells along with scalp irritation and white flakes. The cause of Malassezia overgrowth is not known, but it may be caused by having too much oil on your scalp, hormonal changes, illness, stress. Other causes of Malassezia may include a suppressed immune system, neurological disorders such as Parkinson's disease, not shampooing often enough, sensitivity to the Malassezia fungus. Men have dandruff more often than women. Dandruff usually affects young and middle-aged adults. Sometimes dandruff affects a person for their whole life. Not getting enough nutrients such as zinc and vitamin B can raise your risk of dandruff. People suffering from stressful medical conditions like heart attack and stroke have a higher risk of getting dandruff. So do people with neurological disorders like Parkinson's disease and those with weakened immune systems. Diagnosis. Most cases of dandruff don't require medical care, but you should see your healthcare provider if the dandruff doesn't go away after several weeks of washing with dandruff shampoo. Also, see your healthcare provider if your scalp swells or turns red. Sometimes your healthcare provider can diagnose the problem simply by looking at your hair and scalp. But you may have a condition that seems like dandruff, such as seborrheic dermatitis. You can bring bottles of any new hair care products you've started using to the appointment. Your healthcare provider may be able to tell if the products may be causing your dandruff. Treatment. Usually, washing your hair every day with a gentle shampoo can remove oil and the buildup of skin. If this doesn't help with dandruff, try an over-the-counter dandruff shampoo. There are many different kinds, so you may need to test them out. If your scalp starts to itch, sting, burn, or turn red after using a shampoo, don't use it. In rare cases, you may have an allergic reaction to a shampoo. The signs of an allergic reaction include a rash, hives, and trouble breathing. If these happen, seek emergency medical care right away. Dandruff shampoos contain different medication. Talk to your healthcare provider about what type of shampoo is right for you. Try a dandruff shampoo daily or every other day until your dandruff is controlled. Then, cut back to 2 or 3 times a week as needed. Dandruff shampoo may work for a while and then stop working. If this happens, try switching back and forth between different brands. To get the most out of your shampoo, follow the instructions on the bottle. Rinse well afterwards to get rid of the dead skin cells. If you've shampooed for several weeks and you still have dandruff, talk to your healthcare provider. You may need a prescription-strength shampoo or lotion. Lifestyle and home remedies. You can take steps at home to reduce your risk of developing dandruff. Learn to manage stress. Stress affects your overall health and can cause dandruff or make it worse. Shampooing every day can help prevent dandruff if you have an oily scalp. Hairstyling products like mousse, gel, wax, and hairspray can build up. They can make your hair oily, so you may want to stop using them. Follow a healthy eating plan that includes enough B vitamins, zinc, and certain types of fat. An alternative therapy that may reduce dandruff is daily shampooing with tea tree oil. Many natural shampoo brands contain tea tree oil. For certain people, though, the oil can trigger an allergic reaction.
If you like this video, please like and share. For similar videos, subscribe to our channel.
Summary. Dandruff is common, and most people have it at least once during their lives. It's generally not serious, and it isn't contagious. Dandruff can affect the scalp or any area on the body that grows hair. Dandruff symptoms include an itchy, scaly top of the head and flakes of oily, dead skin in your hair. It can show up on your neck and shoulders. It may be white and dry. The skin on your scalp may look red or pink. Treatment may include regular shampooing, over-the-counter medicated dandruff shampoo, or prescription-strength shampoos or lotions. Dandruff treatment may take a little while to get great results, but most people find a solution. Talk with your healthcare provider about what options are best for you. Thank you for using Explain.